If you're struggling with the aftermath of a miscarriage, this is me saying that it gets better with time. 20% of miscarriages happens without mothers even knowing they were pregnant, especially if you had a miscarriage in the first month or first trimester. Avoid sex until you stop bleeding. Do not gouge and do not use tampons. Hi, hello guys. It's been 1 month since I dropped a video, and I just had a lot on my plate. I was also sick at a certain stage. I needed the time off to heal. I also needed some alone mental time, just some time to pull myself over and try to understand everything happening around me and all that. Today I'm just going to be talking about miscarriages and the trauma and uncertainty that comes with it. If you just had a miscarriage or you've had it before, I know you're just still trying to grasp the reality of what just happened. You probably still trying to come to terms with the fact that you're not pregnant again, and that you lost your precious baby. You also probably still bleeding, or maybe you're done with the bleeding, or you're just trying to get over the entire trauma. Personal questions like why does it have to be me? Why does it have to be my baby? What do I do after now? Do I get pregnant immediately? I understand that this is a very sensitive topic. Just realizing that you are pregnant, you're expecting a child. If there is any consolation, this is me saying that miscarriages happen every time, especially first trimester miscarriage, and 20% of miscarriages happens without mothers even knowing they were pregnant, especially if you had a miscarriage in the first month or first trimester. You might 90% of the time think it was menses because you didn't even notice the changes or checked if you were pregnant. So another one is me saying that most times miscarriages are inevitable, meaning there was nothing you could have done that would have stopped it from happening. Nothing at all. Some miscarriages happen because the body just wants to push the baby out, maybe because the baby was not properly formed, or something was wrong somewhere, and also miscarriages happened. And I'm sorry, I'm very sorry if you're still healing. If you're struggling with the aftermath of a miscarriage, this is me saying that it gets better with time. And if this is any consolation, you can definitely get pregnant immediately after a miscarriage, if you so wish. At this point, I'll just talk about things you need to do after a miscarriage. One of it, or the first very important thing, is to get a pelvic scan or an abdominal scan. I'm sure if the miscarriage happened in the hospital, or even if you did at home, you should go to your doctor, because the doctor will definitely have to request for a scan. This is supposed to indicate or show if there is any retained product of conception, if any of the body parts is still left in utero. Okay, the placenta, the baby's body parts, whatever. It's just supposed to show if there is any retained product of conception. If there is any product of conception, I want you to listen to this part very importantly. If there is any product of conception, your doctor is going to request for an MVA, which is known as manual vacuum aspiration. It's a surgical method of removing the leftover product of conception. Or some doctors will go through the medical method, which is drugs being given to expel the product of conception. Or some doctors want to use both method. An MVA will be conducted together with a drug also given, just to ensure everything comes out. Be very, very careful and ensure that everything comes out, because there are some things you don't share joke with, Imagine if there is a leftover product. It will lead to decay, and it will lead to sepsis, infection, then sepsis, and then from there decay inwards into into you. It's a very, very broad topic. I wouldn't want to branch in. Second thing I want to talk about is cramping. Okay, cramping will last for 1 to 2 weeks or 3 weeks sometimes in rare cases, with spotting or bleeding with pains. Okay, pain medication should be taken for the pains. While if bleeding is excessive, you should go to the hospital. Okay, because it's not supposed to be excessive. Third is medication. All right, you're supposed to take pain medications, as I earlier said, just some NSAIDs or paracetamol if you're an ulcer patient, and then you're supposed to take infection drugs for at least 2 weeks. Your doctor would have prescribed that for you. You should take infection drugs. Then hematinics, some blood builders, just to improve blood supply. My number 4 is rest. I feel you should rest. You should rest for at least 1 week. Some people actually go back to their normal life immediately after. So there's no strict rule for rest. Just rest adequately and make sure you get back your body. You should avoid lifting heavy stuff for at least 1 week, just to make sure your pelvic floor is healed properly. Next point is to eat balanced diet. Just make sure you are eating adequately. Monitor yourself and see that your skin has gotten back, because I know pregnancy comes with so many changes, so monitor yourself enough to see that everything has gone back. Then my final point is to monitor yourself for infection. Avoid sex until you stop bleeding. Do not touch and do not use tampons. Avoid inserting anything inside until you are done bleeding, at least for 2 weeks. Okay, this is just to avoid infection. You should avoid sex, my dear. Assess vaginal secretion, check if you have fever, observe if you're feeling sick, if you have severe abdominal pain. Those are just warning signs that you've gotten an infection, because it's very susceptible for you to get infections. Thank you so much for watching up to this period, and yeah, give my video a thumbs up.